What do you think? Close enough. All right, guys, so we're here today, Mates on Plates, and we're talking to Alexa. Coach Alexa, you've seen her at the gym a lot, and we're going to chat about a bunch of different things. But we're going to start things off with who Alexa is. So, a couple quick questions. Jesse asked me these the first time. How did you start CrossFit?
So I started CrossFit in high school. There was a teacher who started a club in our school, and I had indicated on a survey that it was the one club I might be interested in.
Okay.
So I was like, well, I better go to the meeting for the club because I don't want to not show up.
Yeah.
And I was like, oh, that looks kind of cool. I think she showed us some games videos and stuff. This was 2013, 2014.
The peak.
So it was good time.
Yeah.
And yeah, we started going to the club once a week and the afternoons, and then it became twice a week, and it wasn't very well attended, but
Gotcha.
I went every week. And then by the end of the school year, she was like, well, I can't keep doing this through the summer, so come to my gym. And started going to the gym, and that's where we started.
Sweet.
Yeah.
So then, after high school, you went to school.
I went to school in Florida, so I went to Florida International, which is in Miami,
Okay.
and did my undergrad there while I was swam.
And your undergrad was in?
Nutrition.
Gotcha.
Yeah. So yeah, I did my undergrad and swam competitively there. We won 4 straight conference titles.
Wow.
And it was a great way to finish my swimming career because I started that when I was 5 or 6. So
Wow.
it's 15 years or so.
So those two went together at the same time?
Yeah. I kind of did CrossFit's kind of what got me through the end of swimming. The last couple of years of high school, I really didn't love swimming all that much anymore. I just really wanted to swim in college. So it was nice to have that as a balance. And then it was nice to have something to go into when I stopped swimming. So.
Gotcha. So then you did your undergrad there, and then what?
So then it was COVID, and so I graduated during COVID.
Okay.
And then I went straight into my master's. So I did my master's in nutrition and functional medicine.
Okay.
Through a school in Oregon, and that took me 2 years, and I could just work during that time.
Gotcha.
And then that's kind of the end of that before here.
Yeah. And then that's when we met you, kind of when you joined here.
Yeah.
Now you joined here because?
I joined here because I came to school here. So I'm studying naturopathic medicine at the Canadian College of Naturopathic Medicine, which is just down the street here on Columbia. We're right over top of the SkyTrain station. And we only have 2 campuses in Canada where you can train to become a naturopathic doctor. So one in Toronto and one here. So I moved here to pursue that and needed somewhere to do CrossFit and coach. So
there you go.
Here we ended up.
So the reason for this Mates on Plates is to talk about your schooling and your services. So that's why I want to kind of go over, where you started and what you're doing. And that it's not just been this is, it sounds to me, right, that you've been sort of pursuing this for a long time, starting with your undergrad in Florida, and now this is a progression, right?
Totally.
Yeah. And so now you're doing naturopathic medicine, and you're starting to see people, yeah?
Yeah, so the first 3 years of our program are very much academic. After the first 2 years, you write this big licensing exam. It's our first step of it. You write a second step after 4th year.
Okay.
But we wrote the first one last summer, and once that's kind of the conclusion of all your biomedical sciences. And then 3rd year is much more clinically applicable, treatments and that kind of stuff. And then at the end of 3rd year, starting this year in May, we start seeing patients in the clinic. So 3 days a week, all of us have our own shifts. And under the supervision of a licensed naturopathic doctor, we get to see patients.
Gotcha. So maybe importantly, where is that?
Yeah, so all of my shifts, I'm lucky, are here at the school clinic.
Okay.
So it's located on the 3rd floor above the SkyTrain station on Columbia. So it's
really
a 15-minute walk or less from here.
Less.
I walk there all the time.
Yeah.
And yeah, it's really accessible, obviously, by transit as well. There's some parking right across the street, so it's very central within New West.
Gotcha.
Yeah.
So what are some of those services that you are doing now?
Yeah, so as students, there are some things that we obviously can't do because you have to kind of pursue further training after graduating, which is what I hope to do later on in the future.
Absolutely.
But right now we can still do most things. We're able to be primary care providers in BC. And in BC, naturopaths also have the widest scope in all of Canada, and honestly in most of North America.
Oh, wow.
So we have very broad prescribing rights. We can do injections, we can do minor surgery,
Oh, wow.
we can order lab testing, and we can actually be people's primary care providers. So similar to what your family doctor does with like giving you an antibiotic when you need it or ordering blood work. We can do all those things as well.
Gotcha.
On
Oh,
top
wow.
of doing like shorter, like longer term things
Okay.
with like caring for more chronic conditions. And
Okay.
yeah.
Okay, so yeah, so I mean I know that, I mean this is kind of like CrossFit in many ways.
Yeah.
We're happy to see anybody,
Yes.
right? Like anybody who walks through the doors that wants to work with us, we're happy,
Mhm.
right? But who do you feel like, there's also the other side where we want to work with specific
Mhm.
people as well that want to be here or whatever it might be.
Yeah.
What are some of the things, like how do you feel like you would help people, let's say from the gym,
Mhm.
you know?
Yeah, so I mean, my interest like going forward too is a lot about like sports medicine and like pain management and kind of like chronic pain, those sorts of things. So I hope to be able to do like injection therapies like prolotherapy, PRP in the future. In school, we don't do those things; they require more training. So right now, it's still lots of like hands-on like sports med kind of things are what I
Okay.
want to do. So like we do things like acupuncture, dry needling, cupping. We do like low-level laser and ultrasound therapies for like
Okay.
tendonitis, those sorts of things, like those nagging injuries that people might have.
Yeah, so so what I'm hearing there is like, you know, if you've got like a shoulder issue that you've been dealing with at the gym for a long time, or, you know, maybe a previous injury, a lot of people have previous injuries or sports injuries or whatever it is, and it comes up at the gym quite a bit, you know, like you might be somebody to come and talk to about that kind of thing, right?
Totally.
And let's say someone came to you with a shoulder injury. Let's just call it a shoulder injury
Yeah.
as an example,
Yeah.
because I mean, let's be honest, shoulder injuries is probably the most common thing that we see at the gym, just because of the volume of shoulder work that we do. And it's also probably the shittest joint. Let's just be honest,
It is,
right?
for sure.
You know, like, what would be kind of like the steps to see you?
Yeah, so you can book in either by calling the clinic or by going online. I have a link in my Instagram bio if anyone
Okay.
follows me on Instagram for how
Or
you can,
talk to you.
Or yeah, you can talk to me, and you can book online or call the clinic. It's super easy. And then we kind of have like a 3-step initial process. So you start with an initial appointment, which is 75 minutes long. It could be over the phone, virtual, or in person.
Okay.
And during that appointment, we would talk about the thing that's kind of like your chief concern, the main thing you're coming in for. So your shoulder pain, we talk about all the history of that, how long it's been going on, what it feels like, what makes it worse, what you've tried for it. But then kind of different to when you go see your GP or anyone else, we're going to go through your whole health history.
Okay.
So we're going to talk about you and like what else you've had, like what other injuries have you had, what kind of surgeries have you had maybe, other health conditions you've had, how's your gut health, how's your sleep, all those sorts of things, your nutrition. And we're going to put all those pieces together and we're going to come up with a treatment plan for you that doesn't just address your shoulder, but maybe other things that may be impacting that. Sometimes I find that leads me down another road with someone and like they're very concerned about their shoulder and I'm still going to help them address that. But I'm also like, if it looks like gut health is a big thing for you, we're also going to address that because it's going to get you feeling better overall and help you perform better in life.
That's interesting to me because, like, you know, when a lot of people see service providers in the gym, we're thinking like physio or RMT. It's very specified, right? You know, like there's some good RMTs around. We don't really have I suggest people go to like Catalyst and stuff sometimes.
Yeah.
But it's very focused, right?
Yeah.
Like I've had some people come back and tell me like I go and speak to them and we work on my shoulder and it's an hour on the shoulder in that one part, and then I'm kind of done for the day,
Yeah.
right? Versus that sounds a lot more. I mean, I don't want to sound like too simple, but like holistic,
Yes.
right? But like
Sure.
that seems like a lot more detailed.
Yes. Yeah, I think we'd be like a lot more holistic about it. We would look at more aspects of your pain and maybe even we'd be like, oh, you have stress going on as well. So we might do like some dry needling in your shoulder, but maybe at the same time we do like some acupuncture in more of a traditional Chinese medicine perspective and help you like relax and like center.
So you do acupuncture
We do.
as well as dry needling?
Yeah, we do
Oh, wow.
acupuncture, we do dry needling.
Okay.
I actually did facial acupuncture on someone for the
Oh,
first
wow.
time the other day for like cosmetic
Yeah.
reasons. So
Okay.
lots of things like that. We do cupping. We can do some massage. So we can kind of do
Gotcha.
like lots of those things you go to different providers for. We can kind of do all of them in one. We also
Gotcha.
do like chiropractic adjustments.
Gotcha.
So we can do like manipulations on the spine and on joints. So
Wow.
yeah.
Okay. Yeah, I mean, so you've got a pretty broad. And do you want to focus more on something right now, or is it you're just? I guess for you, it's more about just like getting stuff under your belt, right?
Yes. Yeah,
Right.
yeah, I think that's like kind of where I want to go in the future, but at the same
Mhm.
time, so many people are like, I know I want to do this, and then they start seeing more of something else, like just by chance, and they're like,
Yeah.
oh, I actually love that.
Yeah, yeah.
And that's where they go. And I think in the future, I also want to have a bit of like primary care as part of my practice. Like
Okay.
being able to do everything, I think
Right.
is great. Obviously, my background is in nutrition, so
Right.
like I love seeing people for that.
Mhm.
And it always like ends up falling into my treatment plan. I can't help but like write a treatment
Of
plan with
course.
like adding protein to someone's life or
Right.
like providing some diet advice. Supplements and like herbs and botanicals are also a big part of what we do.
Okay.
So lots of like supplement advice, making use of supplements. We have a dispensary with lots of herbs, supplements, and tinctures in the clinic.
Okay.
So we can actually provide those to people at the time of an appointment. So
Okay.
if they're like, I need more omega-3s, or I think that they should have like ginger for something,
Mhm.
I can actually give them that for a slightly reduced price on the spot.
Oh,
So
good.
yeah.
That's really interesting.
Yeah.
Cool. I guess one of the things that I see as somebody in this industry that comes up quite a bit is are people able to use their like benefits for you?
Yeah, that's
Is
a really
that
good
possible?
question. Yeah, so we can actually direct bill through the
Okay.
clinic. It all depends on your plan, what
Of course.
exactly you can use it for. So some people can use it for time. Some people can also use it for their lab testing.
Right.
But we can order labs through Life Labs, which is nice because that's a big part of like kind of a full functional assessment of someone is ordering blood work and seeing
Mhm.
where things line up and how we can explain kind of some of the underlying questions with that and then
Mhm.
treat based on it. So
That's super important. Like,
Yeah.
that can be such a big barrier, or not just a barrier, that could just be a positive for so many
Yes.
people to be able to use that, which
Yeah.
is really good. Cool. Yeah, are there things that you want to tell me about? 'Cause,
Whoa.
to take me through some
Yeah.
stuff,
Yeah, I mean, so like that is your initial visit, right? We go through that first one and we do that longer appointment. The second one, we would do more physical exams on someone.
Okay.
So that's when we would like, if it was your shoulder, we do a bunch of testing on your shoulder to see if we can identify where it's coming from and what the actual issue is.
Yeah.
We might recommend have some imaging done as well. And then from there, we put together a treatment plan, and then appointments going forward from there
Okay.
would then be based on our treatment. And we might work on multiple things. We might be like, try this and then come back and tell you what you think.
Gotcha.
And then, yeah, we can do again like supplements and stuff like that
Okay.
as part of the treatment plan. If prescriptions are something that someone needs, we can also do that. Like we see lots of people for like hormone therapy and menopause.
Oh, interesting.
That's a big one, and hormone therapy is actually covered by MSP now. So like,
Oh.
although our appointments aren't necessarily covered by your MSP, prescriptions still would be. They would still be covered under your pharmacare. So
Very interesting.
we can write prescriptions for most things. So for people who need like that hormone therapy at menopause, and it can also be a more holistic way. So we're not just kind of writing a
And
prescription and
menopause.
sending you away. Yes, andropause.
Yeah.
Yeah, so we're not just like writing that prescription and sending you away, but we're actually
Yeah.
gonna like look at the whole picture, do
With blood
supplements,
work,
with
yeah.
blood work.
Yeah.
Yeah, so it's definitely a more holistic way to kind of approach healthcare.
That's definitely really interesting.
Mhm.
I mean, that's interesting for someone like myself. On the borderline of getting older, being like a masters athlete now. That kind of thing is definitely more top of mind.
Yeah.
I guess now. What about? I don't. I feel bad because I don't want to just like ask you things and not be able to do them. But like, a big thing out there right now is the like peptides and stuff
Mhm.
like that. Is that something you guys do? I don't.
No, we don't really. There's, I think maybe like a couple, but generally peptides aren't actually legal in Canada yet.
Right. Yeah.
So like we're not going to do things that aren't legal.
Yeah.
Obviously, we
Yeah.
definitely we are a regulated profession, and I think there's like kind of a view of naturopaths out there that we're like kind of like witch doctors or like
Right.
woo woo, and we are very much evidence based.
Gotcha.
We go based off the science, but we also go based off tradition. So that's how we're using things like traditional Chinese medicine and like
Right.
homeopathy that have these like hundreds, thousands of years of evidence behind them,
Right.
even if they're not in like randomized scientific trials. But yeah,
Which is a
peptides-
good thing because,
Yeah.
I think that so many people are going to peptides right now when, there's probably a better researched
Mhm.
way to go about it.
Yeah.
One of the things about peptides that I think it's very popular right now,
Mhm.
but not super well studied.
Yeah. And that's the
Um,
thing, we just don't know like what the long-term effects are gonna be, and
Yeah.
like there is a chance that some of them are gonna do great things, but I think we just don't know enough to like recommend them based on a solid evidence base, and I think for a lot of us, that's really how we wanna practice,
Yeah.
is based on solid evidence.
Absolutely, which is good, and that means that you have the framework there of what you can work within,
Mhm.
which is good because out there right now it's kind of the wild west
Yeah.
for that kind of stuff.
Yeah.
And I mean, where are they getting it, whatever. So like being able to come and talk to you about an actual plan
Mhm.
with the research along with it
Yeah.
is more important.
Exactly.
Cool. So you kind of we've talked a lot about the, like a shoulder pain kind of thing.
Yeah.
But, I think it sounds to me like you have a lot of information and a lot of passion towards nutrition. If someone was looking to work on their nutrition with you, what would that look like?
So I mean, the initial appointment's going to be very similar, that we're going to kind of bring you in and see what it is your concerns are, go through that whole history, and then we could write you plans based on that.
Gotcha.
And then we would just be able to do, like, I've done nutrition work kind of as its own business in the past, and I just kind of feel like limited by the fact that I can only recommend, like, I have to be careful where my scope goes, versus in this realm I can be much more broad.
Gotcha.
So I can say, like, this is great, but like it looks like also maybe there's a digestive component here. So maybe we need to address like a SIBO kind of picture, an IBS picture, and we could actually address more things than just your diet. We can also look at like what else is affecting your ability to absorb nutrients, or why aren't you losing that weight that you're really trying hard to lose. And if we really need to move to something even like Ozempic, not that it's going to be our first line, like we have that in our tool belt. So it's just that like broader scope of being able to reach for different things as we need to escalate.
Which is also really good in terms of, pairing that with blood work as well. There's so much discussion within the industry, and I think around the world right now about stuff like Ozempic and stuff. And I think it can be used as a tool. If used correctly with maybe supervision is probably the best way to do it. I mean, with anything, right? So going to see somebody that has that scope is probably, and I mean, that also completely depends on somebody's, we're kind of like leaning towards like if you want to lose weight, but I mean, there's so many different avenues within nutrition as well. Cool.
Yeah, you talked about like blood work, kind of monitoring things too. We have the ability to like maybe track you if you're just starting at the gym and like your doctor's told you your cholesterol is high or like your blood sugar is not great and you're kind of on that verge of needing to take medication and you're like, oh, I'm going to start CrossFit, this is going to help me. We have that ability to like maybe do your baseline labs. You keep coming to the gym, you keep working here, and then in like 6 months time we can redo those labs and then we can kind of make that comparison. So it's a good like partnership with getting into working out.
And with your background, I think one of the things that could be interesting there is also, like, I've heard this quite a bit because CrossFitters take things like creatine and blah, 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 like they go get their labs done, and their labs come back and their doctor's like, your creatine is like 10x, your liver is shutting down, you know what I mean, but I think you'd have a different scope on that, because of your background, I don't even know, so maybe that's an interesting question, not related, but what supplements do you take? We've never even talked about this, I think.
I've kind of like changed some things over the years, like being in this program, and we get lots of like supplement companies that come to us and like we get to try things. So I was actually thinking about this last night. I was like, what will I continue taking when they're not free for me anymore? But I think there are a lot of things that are really valuable. When I like think about what I would give pretty much everyone, like I think vitamin D is huge, because basically everyone is deficient because we don't really see the sun most of the year here. I think omega-3s can be valuable for a lot of people. I take those. I do protein and creatine every day. I think creatine, like there's just more and more research every day about how great it is. And it's better and better. Every day it seems. I really have no issue with creatine. It's definitely something I usually put in people's little stack. I also do magnesium, which I think is great for like, it's good for sleep. But it's
what type of magnesium?
So I do bisglycinate for myself.
Gotcha. And that's how you say it. Okay, cool.
That's how I say it. And I do that like for sleep, but also just like for muscles. But different types kind of we would.
Do you take that at a specific time? I'm asking for myself now.
I take it at night. Because I take it mainly for sleep and like relaxing at night. But it kind of depends on the person and what type you need. And like maybe we're trying to like work on the gut. Maybe we're trying to like alleviate constipation. We might choose a different type. But and then what else do? I do a bit of a probiotic right now. I don't always do that, but I have one.
Gotcha.
I do like vitamin C and zinc in the winter when I'm worried about maybe getting sick. So, and then I do like an adrenal support because being in a program like this where you're like constantly adrenally fatigued, I do some stuff with like adaptogens for adrenal support. And I think that's a big one for a lot of people because they're so stressed and they don't even know how to deal with their stress. And there's some great herbal things that can just like help kind of manage your hormones and your stress a little bit without having to go to everything too insane.
Gotcha.
Yeah,
I tried zinc a little while ago and it messed with my stomach.
The metals can be tough.
It was really, really rough. Like I would just feel really sick and I liked the effects of it. I felt really good on it, but I just couldn't deal with the stomach thing. Maybe it was how I was taking it or whatever, but you know, it was just timing.
Yeah.
You know, like I don't know if I'm gonna go. Maybe I should try it back again, but it was
Yeah.
rough.
Yeah.
It was rough. I'd feel really crap.
Yeah.
You know.
Yeah,
But-
iron can be like that too, and for a lot of women who are
Yes.
iron deficient, it can be really tough. So we can kind of go through some different ways. We have different forms of supplements we can do to help people with that.
I see that very, very often,
Yeah.
and maybe that's, and it's women in general,
Mhm.
more likely.
Mhm.
Oftentimes with some sort of dietary restriction,
Mhm.
whatever that might be, you
Mhm.
know, being vegetarian or, I think that's probably the one I see it in the most.
Yeah.
But I mean, and I think that would be would that be something that somebody could come talk to you about?
For sure, yeah. I mean, iron is a huge thing that we see in so many people, and like it's often a cause of fatigue too.
Yes.
Like especially women who are still menstruating, like they just come in and they're like, I'm just tired all the time and I don't know why. And sometimes it's an easy answer. We just need an iron supplement.
Right.
Because their ferritin is just so low that there's like no way for them to carry oxygen to their cells, and it's
Yeah.
like no wonder you're so tired.
Yeah.
And
tired
it
all
can
the
make
time.
like a huge difference. So just finding the right form for the person, and MDs also have the option to do iron IVs. We don't do them here in the clinic, but like if we discovered that that was the best option for you, then we could like refer you on to someone else to do an iron IV and get like a good,
That sounds good.
Yeah.
I mean, I probably feel way better after.
yeah,
Yeah.
yeah. So there's
Cool.
lots of options there.
Cool.
Mhm.
Any other things any other services that you want to point out? I guess it's like, to me, I mean, it sounds like you have a very broad scope.
Yes.
So people could come to you with a lot of things.
Yeah.
But I think there's also maybe that like, it's like those things that you're good at, right?
Mhm.
Like or passionate about.
Mhm.
Are there any other ones that you feel passionate about?
I mean, I do love anything that's like women's health and like a little bit of like hormones and like even like pediatrics and kind of like teenagers. One of the things that like drew me to medicine very early on was I wanted to do like kind of like gynecology and just like teenagers. I was like thinking I wanted to kind of be in that pediatric world, and
Okay.
obviously I've taken a bit of a shift from like conventional medicine and all those things, and like this is a better fit for me. But I definitely would be interested in like seeing kids, helping with
Okay.
like kids and like that kind of puberty transition and like
Gotcha.
all those sorts of things.
So like let's say the members of the gym, if they have
Mhm.
like a kid of that age.
Totally, yeah. Yeah, I think a lot of people think like, oh, going to naturopathic medicine is only when you have like a chronic condition and you're like older, or you need help with menopause because no one else is helping you, but like
Right.
we can literally help across the entire lifespan.
Okay.
So, you know, I saw patients a couple weeks ago with dementia, and we were dealing with like dementia. But I also have some colleagues who are seeing like some fairly young kids right now. So yeah, totally happy to see kids and kind of help them
Interesting.
through that transition, because a lot of the things that we're using in adults we can use in kids as well.
Gotcha.
So
Or if you have a parent, I mean, a lot
Yeah,
of
an
our,
aging
a lot of
parent
our,
as well.
yeah, a lot of our
Mhm.
members have those aging parents that,
Mhm.
you know, transitioning to a different lifetime,
Mhm.
you know, or a phase in life or whatever
Yeah.
it might be. That's, I mean, that could be good for our members or anybody
Yeah.
to know about.
yeah.
Cool. Okay.
Yeah.
I guess maybe a little bit more about Alexa. This week, a week away, we've got semifinals. You're about to do those.
Mhm.
If you didn't know, CrossFit releases the last set of workouts before the games. So there's gonna not be a big field here, I would say, in the world doing that. You had to come top.
2,000.
Yeah.
So top 2,000 at the quarterfinals, and like it was the same about number last year, and I think maybe only like 300 or 400 signed up. So it'll be interesting to see with the different timing in the
Yeah.
season how many people.
And just to put it in context, they're giving away 7 slots out of
Mhm.
that 2,000 to people to go to the games.
Mhm.
You know, so the people that have made it to this point and who are within that area, or let's call it like the tip of the spear of CrossFit, I would say. We find out that we're dating this. Hopefully, I can get it out in today or tomorrow. The workouts come out tomorrow.
Yeah.
Excited. We're looking at what, 5 or 6?
Yeah, I think 5 or 6. I think I'm excited to like find out what they are. I'm trying to like really frame it well for myself and say that it's like a celebration of like all the work I've been putting in
Mhm.
so far this season. I feel like it's been like a lot of training on my own, just spending like a lot of time in the last, it's like really since quarterfinals.
Yeah.
So I'm hoping that all that will pay off and
off.
we'll just have a good time. So,
Yeah.
yeah.
That's exciting.
Yeah.
Is there anything that you want to see come up?
That's a good question. I mean, we haven't had any rope climbs yet, so I might be okay with that. A heavy barbell would be fun too, because we really haven't had anything heavy. So,
That's true.
and then a like a longer cardio workout is usually good for me, and we haven't
Gotcha.
had one of those yet either.
Yeah.
So like I would be happy with
we
that.
haven't seen anything past 13 minutes or something like that.
Which is pretty
so far.
crazy.
Yeah, which is rare for
Yes.
this point of the season
Yeah.
to not have that yet.
Mhm.
I mean, other semifinals events around the world have had those.
Mhm.
Not all of them,
Yeah.
you know,
Yeah.
which is pretty crazy to this point. But yeah, we're kind of getting close to it, which is exciting to be able to just. I think there's a lot of pride in being just getting to that point of the games, or in the game season, I should say. You know, getting to semifinals is a huge achievement.
Mhm.
You're going to be doing them in Victoria, yes?
I am,
Okay,
yeah,
cool.
because I have a good like kind of judging system set up. We did it last year, so we got like a
If
whole
you don't
plan.
know, the judging system behind this is wild.
Crazy.
I actually was just speaking to Emily Rolfe, just because she's like, do you have your judge? Because
Yeah.
you have to have people in place
Yeah.
at the right time. You have to have multiple judges. It's not just one at a time. There has to be
Mhm.
two at a time, and it's a big deal. And
Yeah.
these videos are heavily reviewed
Yeah.
as well.
Yeah.
So yeah, even just getting them done takes quite a bit of effort.
Yeah,
Like
I love
there's
like scheduling and planning and like showing different people in the frame and your
Yeah.
password, and everyone has to introduce themselves and yeah.
and then getting the floor plans right, and then the uploading correct. And it seems like not that big of a deal, but man, it's a lot of work.
when you're already like stressed about doing the workouts well, it definitely like you're already up here with your stress, and then
Yeah.
it's like the tape's 2 inches off on the floor, and then everything, and then or you can't see in the camera, and
Yeah,
there's a
and
lot
then
of tension.
the order of workouts that you're gonna do
Yeah,
them and
you're
all.
gonna redo.
Yeah,
and,
aides are going to redo and all that,
Mhm.
all that kind of stuff. But that's exciting. I mean, that's a huge accomplishment to get there. So, and that's the second year in a row with us.
Yeah.
I think you've made it there every year with us.
Yeah, I guess this is the second year of having like the online semis, so we're 2 for 2. Which is
Yeah,
good.
which is good. Which is
Yeah.
good. Exciting. Cool. And then this year you're going to be with us all year.
Yeah.
You usually go away during the summer, but
Yeah.
you're with us all year.
Yeah.
And then seeing at the end of the year, we're looking at Fraser Valley Throwdown.
Yeah,
maybe?
probably.
Sweet.
Yeah.
And then coaching with us more,
Yes,
maybe
coaching
a
a
little
little bit more, and
bit.
yeah.
You're seeing Alexa at the noon class on Fridays now, and then you never know in the future how things evolve. But yeah. Any questions for me? And it can be broad, like it could be about the gym or anything. I should have probably prompted you on this before.
I should have had a question to come up with.
And it's okay if you don't.
Yeah, I don't know if I really have any, but yeah, I'm
Okay.
excited. Thank you for
No.
giving me the chance to like motivate people to come in and see me, and yeah, I just love to have people come in. It's also a great way if you're just like curious about naturopathic medicine to
Yeah.
come in, because it's a lot cheaper than going to like a naturopathic private practice.
Yeah.
So an initial appointment's only $65 versus if you're going to someone in private practice, it's like over 200. So.
And you have access to Alexa. Like she's at the gym. If you have like a question, like, "Hey, would this work?" and it's not like she's gonna be like, "Absolutely, always." You know, it's like there's gonna be that honesty there. She knows you guys, so you know, you corner her maybe after class or something like that to sort of ask, you know, would this be a good thing to come in and talk to you about? And then maybe book a time.
Yeah, or send me a message if you just have like some stuff you're wondering, and then I can kind of direct you the right way. If I'm not here at the same time, there's some people I don't see very often.
Yeah.
So yeah, if you're curious and want to come in, then just send me a message and we can set something up.
Sounds
Excited.
good. Okay.
Yeah.
Well, that was speaking to Alexa. Our next one we'll be doing hopefully soon. But yeah, that was for today. Great. Thank you very much.
Thank you.
All right.